So this morning I'm joined again by Dr. David Keegan from the Mater Hospital. I'm June Tinsley, Head of Communications with NCBI, and we're doing this series of discussions around different eye conditions. And this morning the focus will be on cataracts. So good morning, Dr. Keegan, and thanks again for joining us.
Good morning, June. Thank you for having me on.
Great. So we may as well get straight into it. If you wouldn't mind explaining what the condition of cataracts is.
Yeah, cataract is a very common condition. Lots of people are affected by cataract. And what it is, it's a clouding or an opacity of the lens inside your eye. The lens in our eye is quite a remarkable structure. It focuses light. And when we're younger and we've got a more flexible lens, we can see clearly into the distance. And then when it changes shape, then we can see clearly for things up close by a process called accommodation. But as over life or in certain disease conditions, the lens can get a little cloudy. The crystals inside the lens can harden and opacify. So the ability to transmit light diminishes as we get older, or again, as I say, in certain disease conditions. So it's characterized by a gradual onset of blurred vision. And typically in most situations, this comes on over a period of years. It may come on quicker than that, but generally it's over a period of years. People would notice a deterioration of vision. They might notice it first for sort of a slight blur in the distance and then for things up close. And paradoxically, in some forms of cataract, people can get an improvement in their reading vision, which typically deteriorates after the age of 40 or 50. They might find suddenly that they're back to their older type reading glasses or being able to read without glasses. That's because of a phenomenon called myopic shift, or where the center of the lens hardens a bit, that it makes it a slightly stronger lens that people can read a bit better with it. But then the vision goes blurred and cloudy after that. By and large, it's a common condition, leads to gradual blurring of vision, and we'll talk a little bit about how we can fix it.
So what would you describe then as the causes of this condition?
Particularly, it's associated with us getting older. As the lens stiffens as we get older, that's the most common cause. We call age-related cataract. But there are other conditions that can hasten the progression of that cataract. Trauma, inflammation inside the eye, diabetes. Diabetic patients on average get cataract 15 years prior to non-diabetic patients. And they're typically the causes of cataract that we would see.
And you mentioned there about the blurring of the eye as one of the primary symptoms. Is there any other symptoms that patients should potentially look out for?
Yes, it's absolutely. That's the commonest cause. And interestingly, previously about age-related macular degeneration, the symptoms between the two can be quite similar, as a gradual blur of vision. One of the other symptoms that alerts us to cataract is glare, where people driving, say, in low light levels at dawn or dusk, particularly in the winter, or oncoming lights from traffic, they can get a certain onset of glare. You get that in a type of cataract called cortical or posterior subcapsular cataract, where when the light hits it, it scatters and gives you that glare effect and phenomenon. It'd be quite disconcerting. And even for people who retain very good vision, if they get this symptom, particularly if they're driving at nighttime, it can be quite dangerous. And it'd be one of the reasons why we'd accelerate somebody to have cataract surgery done, is that they did have those symptoms.
And you alluded to surgery there as a possible treatment. Is that the only treatment?
It's the best treatment. There are plenty of other things being mooted around the place, eye drops or taking certain extracts. But basically, if you've got cataract that's visually significant, i.e. that it affects your quality of life, your ability to read, watch television, do your job, perform your hobbies, well, then you're best to have that cataract removed by an eye surgeon. And cataract is the commonest operation performed worldwide. It's the commonest operation performed in this country, but it's also the operation with one of the highest satisfaction rates for patients. And we say to patients, we have a 95% chance that we'll improve their vision with this operation. And overall, there's about a 1% chance that their vision will be worse afterwards. So by and large, it's a highly successful treatment. And like many of these treatments where we need to get broad access to patients, it's access to care that is the issue in this country, making sure that we can get enough slots on theatre lists for all our patients to be treated.
And in terms of if a patient was to undergo that surgery, is there much recovery time required or anything like that?
With modern cataract surgery, not so much, because it's done to a very small incision. It's a very efficient technique. The procedure takes about 10 to 20 minutes, depending on the complexity of the case, to be done. And we put an artificial lens inside afterwards. So people usually have good visual function straight after the operation, because often we don't numb the eye or block the eye anymore. We'll just use anesthetic eye drops to do the procedure, and people can see straight afterwards. It's actually quite heartening to see, particularly people with cataract who are, say, very short-sighted all their lives, straight after their operation, be able to read a clock from across the room after the procedure. Some people, it can take a little bit longer. It can take a couple of days to get back to a good level of vision. And some people, it can take longer again if they get some swelling at the back of the eye. You get that in between 1% and 5% of cases. Swelling at the back of the eye after the operation, that can delay the visual recovery, but generally they make a full recovery thereafter. And like I say, it's a very successful procedure, and we're fortunate to have a lot of technology at our disposal now that we can predict the outcome in the eye much better, so we can set our surgery up, where we make our incisions and the type of lens that we use. We've got special lenses now that correct astigmatism, or that irregularity in the cornea, called a toric lens, again leading to better visual outcomes. And we've got a whole range of newer lenses called multifocal lenses, which can leave people with good distance and near vision, or intermediate vision. They're not for everybody, but they're a good tool to have available to us for patients that wish to have them.
And just another question, if a patient does have a cataract, are they likely to get it again, or is it a once-off?
It's a once-off, very good question. It's a once-off condition, and once the cataract is removed and the lens is placed, you won't get that cataract again. Now, about 30% of patients get a condition after surgery called posterior capsule opacity, where you get a frosting of the membrane behind the artificial lens, and that needs to be lasered away by a process called a YAG capsulotomy. And that's very straightforward to do and takes just a matter of minutes. And we do that in the clinic. But you can't get the cataract again.
But you could get it in another eye.
You can get it in the other eye, yes.
Yeah. Okay, well, I suppose it sounds very reassuring that it's a very common condition, and the treatment is very, very successful. And is there any other kind of helpful rehabilitation supports or services available to people while they have this condition and are awaiting treatment?
What we do to patients, particularly if they've got cataract, it's not visually significant, we just recommend update the glasses and then go back and see your eye doctor about a year or 2 years later to see if it then is visually significant and needs to be done. If you do have cataract and it is visually significant and you're on a waiting list to have it done, it's immensely frustrating, because you know that there's a procedure there that, as I say, takes 10 to 20 minutes, and you will be have much better vision as a result of it. So that's the frustration. We're looking to tackle that across the country with new dedicated cataract units in Dublin and in Tipperary, and we're looking to build other ones in other parts of the country as well. And when they come on stream, the wait time for cataract surgery will come down. And we're really, across and through the College of Ophthalmologists, we have a stated goal to reduce the wait time for cataract surgery, which in some parts of the country is 18 months, which is shocking. But we would have everybody have their surgery in less than 6 months. And we'd have a personal target in our hospital of less than 3 months that would be able to get people in for their cataract surgery. I believe that's probably about 2 years away. That may be delayed further because of COVID-19. But we look to get the surgery done in a timely fashion. If you are waiting for it, update your glasses. You can use a magnifier, large screen televisions, and keep in regular contact with your eye doctor about getting on an operating list to have the surgery done.
Okay, excellent. And I suppose for any listeners, if they have any questions about additional aids or supports that NCBI could offer, feel free to phone our helpline, which is 1850 33 43 53, and the supports are available right across the country. So we'll leave it there for now, Dr. Keegan, and as I said, we'll come back to continue this series on other eye conditions later on. Great. Thanks very much for your time.
Thank you. Thank you.